Hello, Todd Fergus, cardiologist from Green Bay, Wisconsin. Let's talk cardiac arrest. The term cardiac arrest has been around the news a lot lately. First with Damar Hamlin, the football player for the Buffalo Bills last fall who had a cardiac arrest, and then now more recently, Bronny James, the incoming freshman basketball player at USC. First, let's get some semantics out of the way. A lot of people confuse the terms heart attack and cardiac arrest. A heart attack is when there's damage to the heart muscle, something that we call a myocardial infarction, and that usually occurs due to a blockage in the coronary artery. Heart attacks can lead to a cardiac arrest, but most of the time they do not. A cardiac arrest is where the heart goes into a malignant or dangerous arrhythmia, usually a tachyarrhythmia, so something that's going really fast. So a ventricular tachycardia or a ventricular fibrillation. Both of these are where the heart is squeezing so fast that it can't generate any cardiac output to perfuse blood to the brain, and the patient will either pass out, or if it lasts long enough, they'll actually pass away, unless that patient is treated with a defibrillator to shock the heart back into a normal rhythm. Now let's talk about the causes of a cardiac arrest. In older adults, the most common things would be something like a heart attack or maybe a cardiomyopathy, which is a weak heart muscle that predisposes a patient to a malignant arrhythmia. In younger patients, it's usually something more rare that's going to cause a cardiac arrest. And I'd like to break it up into two categories. One is things that are potentially correctable or reversible, and the second category are things that aren't necessarily correctable or reversible. The correctable things would be something like what Damar Hamlin had, which is commotio cordis, where he happened to receive a severe blow to the chest that triggered the heart arrhythmia. This is really a 1 in a million circumstance and is unlikely to happen again, so it doesn't necessarily predispose him to having another cardiac arrest. Another potential reversible cause would be something called WPW, or Wolff-Parkinson-White syndrome, where there's a particular abnormal electrical pathway that can lead to a cardiac arrhythmia, and that accessory pathway or abnormal electrical pathway can actually be ablated or cauterized to remove that risk of future cardiac events. And then the third reversible thing would be something that causes a abnormal EKG pattern called long QT, and certain antibiotics and other drugs can prolong the QT. Certain electrolyte abnormalities like low potassium or low magnesium, which could be caused by eating disorders or excessive diarrhea or vomiting. These things are potentially reversible causes of arrhythmias that wouldn't necessarily be expected to increase a person's long-term risk of having another cardiac arrest. Now let's talk about the irreversible causes of cardiac arrest. One would be something like a hypertrophic cardiomyopathy, and that's where there's a thickening of the heart muscle that predisposes patients to malignant arrhythmias. Now this thickened heart muscle can be treated with surgery, but thinning that heart muscle with surgery doesn't necessarily reduce that patient's risk of a malignant arrhythmia in the future. A second irreversible cause of a cardiac arrest would be something called arrhythmogenic right ventricular dysplasia, which is a structural abnormality that can predispose patients to arrhythmias. And then a third non-reversible cause of a cardiac arrest would be congenital long QT syndrome. So similar to what I was mentioning earlier, a long QT can be caused by drugs or electrolyte abnormalities. Some patients are just born with this long QT interval on their EKG, which predisposes them to arrhythmias, and that's not something that can be corrected. So I mentioned that it was decided by Damar Hamlin's doctors that his cardiac arrest was most likely caused by the commotio cordis. So what is it that caused Bronny James' cardiac arrest? Well, it's very early, and I'm sure even his doctors don't know, and I hate to speculate, but there are some things that we can probably rule out. He probably has had some screening EKGs and maybe even a screening echo in the past. This is something that's common for all professional basketball players to have. Most college basketball players and even some high school basketball players would already have a screening EKG or an echo. So this would have pretty much ruled out long QT syndrome, would have ruled out hypertrophic cardiomyopathy, and maybe ruled out arrhythmogenic right ventricular dysplasia. Something like WPW syndrome usually would have clues on the EKG. And then that leaves what's probably the most common cause of a cardiac arrest, which is what we call idiopathic, which means we never know. So for athletes like Bronny, who survived a cardiac arrest, what is the likelihood that he's going to play basketball again in the future, or at least competitive basketball? Well, if he had one of the reversible causes, one of the treatable causes like WPW or a drug-induced long QT, then if those things get corrected, he could potentially play again. But if he has one of the irreversible causes like hypertrophic cardiomyopathy or congenital long QT syndrome or arrhythmogenic right ventricular dysplasia, then he's probably going to need a defibrillator to protect him from future cardiac arrests, which is an implantable pacemaker that would shock him out of that arrhythmia if it happens again. And once that happens, it's unlikely that he'll play competitive sports again. But again, I'll leave that for his physicians to decide. Thanks a lot. Take care.